We developed a study to look at the BAUD, the Bioacoustical Utilization Device, which has been around. Dr. Lawless had developed it many years ago to look at the impact of it in treating distress. And we were trying to do this as really a neutral party and really examining how the device might help alleviate distress in a clinical population. And we want to see if this works and if its effects hold up relative to other treatments, or if it works better or the same as other treatments. So the first thing is we were looking at what really is distress. Next slide, please. And so distress is a response where there's a negative valence or a negative emotion or even a negative physiological reaction in response to an internal or an external stimuli or triggering. And that response could be sadness, it could be stress, it could affect us socially and spiritually, we can have pain as well. And it could be going on from a variety of different causes. But again, the ultimate part here is that there's a negative experience that's occurring in different people. And oftentimes people, when they have distress, they feel that they're unable to cope with the changes when there's a disruption to their normal life activities, whether it's by disease or by change in their circumstance that's outside of normal control. Sometimes there's also distress to normal life events as well, but oftentimes the distress is experienced at a high level when a person feels that they're unable to cope or manage with the changes. The physiological changes would be something like heart rate changes, but psychologically, we feel maybe stressed out, feel anxious, feel sad, or even the physiological, like I said, would be heart rate, but it could also be blood pressure changes. And so again, these are an interactive response in the body as well. And if they're unresolved, the long-term presence of these experiences has a detrimental effect on the human body and on the human mind as well. And many people, unfortunately, lack the tools to adequately to resolve, reduce, or manage these experiences. And that's what we want to try to find a way, is to give them something that they can add to the tools that they already have to help with their experience. Next slide. And so if we look at the background for things like biofeedback and neurofeedback, this is not new science. Biofeedback has been shown to be effective in a variety of different therapeutic experiences. But in summary, very briefly, biofeedback is the process of giving a person information about their own body, and neurofeedback is the process of giving a person information about what's happening in their brain. And we can reinforce positive changes through conditioning or operant conditioning. So we could be looking at things like heart rate or respiration for regular biofeedback or electromyography. But where for neurofeedback, we're looking at brain waves or EEG data. And the evidence has been present with research studies in ADHD, with anxiety, hypertension, physiological diseases like Raynaud's, which affects circulation to the peripheral parts of the body, and even seizures. Next slide. And BAUD, or the BAUD-BPM, is not a typical biofeedback or neurofeedback. What it really is, it's creating a sound wave. And this is a novel application of an old treatment that's been around. There's been the use of drum beats in shamanic ritual healings. It's been evidenced and shown in papers going back as far as the 80s, looking at older historical use of the drum beats in shamanic healing rituals. And the BAUD-BPM really harnesses this pattern of sounds and stimulates the nervous system via this auditory system. There's no monitoring of what's happening within the person as a rule, so that's why it's not biofeedback or neurofeedback. It is self-directed, so the person who's listening to the audio tone is controlling the device and is finding the tone that's appropriate for them, which means that there's going to be limited therapeutic or therapist involvement. So the therapist or the provider isn't directly going to need to control the device. The participant or the patient is the one that's using the device and is actively controlling it, which might mean that we're going to have shorter sessions because the device doesn't need to be for a 45-minute therapy session, and can be used in a very shorter period of time in the event, during immediately if they need to, but they can also use it outside of the therapeutic session typically. There's no active conditioning or learning or retraining of the brain waves. This is something that the person has a tool to use, just like they're going to, if somebody goes to exercise, if they're on the treadmill for 20 minutes or half an hour, they're having a health benefit of that. This is something that they get a direct benefit from using this. Next slide. And so the BAUD-BPM looks like the device pictured here. Currently it has 4 knobs to control. 2 are for the volume, 1 for left ear, 1 for right ear, because the difference between the 2 ears is the key factor. There's a knob that controls the main sound frequency, And then there's a knob that controls the difference that's going to be experienced between the two ears. And that difference is the key factor of what we're looking at. Next slide. And so the binaural beat, frequency, pulse, or tone is what we're really looking at. And it's this difference that is experienced between two ears. So each ear will hear one frequency, and the device is going to be adjusted by the user, okay, to the main frequency initially by that main knob. And that's going to range between 0 and 350 hertz, okay? And once they find the right hertz tone, I guess it's really 0 to 330 as noted below, that's going to be the main sound. And then they're going to adjust with the disruptor knob between 1 and 20 hertz. And that's going to give us that binaural tone, the difference between the two ears, which is going to be experienced in the brain as a singular tone. Okay, it's combined in the brain, and that's the binaural tone or binaural frequency. Or in this case, we're talking binaural pulse maybe. Next slide. And so the goal of the two studies that we had done was to determine whether the BAUD-BPM would be effective in alleviating symptoms of emotional distress. And we wanted to collect, on the second study, a small subset of participants to look at the biological data from before and after treatment with BAUD to see if there was a change on functioning in the brain. Next slide. And so the method we had collected from 59 adult participants from 18 to 60, presenting in a hospital in Cuba. They were evaluated by 3 clinicians. They completed self-report measures, including for anxiety, post-traumatic stress disorder, COVID-related stress, or depression. We are not particularly looking at the depression in the outcome today. The depression results were non-significant, just to put that out there. But we found significant results for anxiety and distress. We had 4 treatment groups. We had the BAUD-BPM treatment group. We had the treatment as usual group, where they either had psychotherapy or medication, a sham treatment control group, and a waitlist control group. The protocol for the intervention with the BAUD was 8 sessions of 15 to 20 minutes, twice per week for 4 weeks. Next slide. And we collected measures before we started the study, during the process of the study, at the end of the 4 weeks, and also we did follow-up 4 weeks after and 12 weeks after on anxiety, the COVID stress scale, and also the PTSD scale, or the PCL-5. Next slide. And if we look at anxiety on the main effect between the treatment groups, we found that there was a main effect for the treatment, okay, with a pretty strong, significant result. Next slide. And if we look at the subgroups here, we see between the treatment group and with BAUD and the traditional treatment that there's a non-significant difference. However, when you look, so it's just as effective, it looks like, as traditional treatment. When we look at BAUD to sham treatment, that there is a significant difference. And if we look at the difference between the traditional treatment and sham treatment and waitlist control, we also see a significant effect. So the BAUD, this is indicative of the BAUD intervention, or the BPM intervention, having reduced level on anxiety scores at the end of intervention. Next slide. When we looked at the COVID stress scale, again, a main effect between the different treatment groups. Next slide. And when we compare the BAUD to traditional treatment, we actually also see a significant difference here between time 1 and time 2. And when we look at between between group 1 and group 2, so we have between the 2 treatment groups. And when we look at between the treatment group and also the sham treatment, again, we're seeing a significant difference, indicating that the BAUD looks to provide a reduction in COVID-related stress, even though, again, COVID still was present at this time, but people were feeling less levels of distress. And actually, if we look here, we see that there's no significant difference between the treatment group as usual and the sham treatment. Next slide. If we look at the PTSD scale, okay, the PCL-5, again, the main difference between treatments. Okay, next slide. And when we look at the specifics, when we compare the groups, that there's not a significant difference, unfortunately, between the BAUD and the traditional treatment, okay? And that was actually also present. We didn't see significant differences within the subgroups. But again, it's indicative that there is something going on here, but we weren't able to tease out. We might need a stronger sample size, a larger sample size, or a longer intervention, or a longer, more interventions per week. But next slide, please. And so the evidence here, and that we're now looking at, is this subgroup, and I'm going to call on Dr. Leisman in a moment, but we're looking at a subgroup where we have one control subject and 3 of the subjects that were actively involved with a BAUD treatment. And there was a significant difference that we're going to see between these participants. So I can very briefly just say that, again, since I was going to leave over the biological stuff, so with the demands that we're seeing in the medical systems across the globe, the overly pull of needing for services, the ability to give people something that they can use on their own is a pretty significant tool that we can bring into the market, that we can provide to people. And the BAUD-BPM may provide a method for individuals that manage their own levels of distress without having significant side effects, without long wait list times, without high costs in terms of comparison to long-term medication or therapies. And it may also allow for people to avoid the development of more serious patterns or more entrenched patterns. So we can avoid perhaps people from going from a high level of stress to something like a full-blown PTSD if we intervene early. We can maybe avoid the development of presenting people to the mental health clinics because we're helping to reduce their level of stress at the time of stress.